Welcome to the deep dive. Today, we're really diving into a massive global health issue, non-communicable diseases,
Mm.
NCDs.
Things like heart disease, cancer, diabetes.
Exactly. And the scale is just, well, it's staggering. They account for almost 74% of all deaths worldwide.
74% is huge.
It really is, which obviously means we urgently need new approaches, especially for catching them early. Okay, let's unpack this a bit.
Right. And one of the most exciting developments here is, well, artificial intelligence, AI.
Yeah.
So this deep dive, we're going to look at a really thorough bibliometric analysis. It's by Aldecca and Swyla, and it maps out how AI is being used for that early identification piece and also for assessing risk with NCDs.
So the goal for you listening is
It's basically to get a solid, kind of concise overview of where things stand in this, super fast-moving field.
okay, got it. And the sheer amount of research here is something else. This study pulled data from Scopus, right?
That's right, a huge database.
And they found 1,745 relevant articles just between 2000 and 2024.
No.
But here's what really jumps out the growth. It's exploded recently.
Absolutely. It's
I mean,
exponential.
the citations went from, 14 in 2003
Tiny numbers back then.
to nearly 6,950 in 2021. That's just incredible growth. What does that tell you?
Well, it tells me AI isn't just theory anymore in this space. It's becoming a practical tool. Researchers are clearly seeing real potential.
So how is it being used, for early detection? Give us some examples.
Okay, so take Alzheimer's. AI is helping analyze MRI scans, looking for these tiny biomarkers, these little clues in the brain structure. Combining that with deep learning allows for potentially much earlier diagnosis than before.
Wow. Okay.
Or diabetic retinopathy, it causes vision loss.
Right.
Deep convolutional neural networks, CNNs, they're great with images. They're getting like 94.5% accuracy classifying retinal scans.
84.5%. That's
Yeah.
really impressive. Better than human experts sometimes.
Potentially, yeah.
Yep.
For picking up those very subtle early signs before major damage occurs.
Okay. Any others?
Yeah, lung cancer too. There are newer methods using breath analysis, basically analyzing the chemicals in your breath with sensors and pairing that with deep learning, moving beyond just imaging.
Interesting. So that's the detection side. What about predicting risk? Sort of looking into the future.
Uh-huh. That's the other big area, risk assessment.
How's AI helping there?
Well, for heart failure, deep learning is getting better at predicting, say, if someone's likely to be readmitted to the hospital within 30 days.
Yeah.
That helps doctors intervene proactively.
Okay, that makes sense. Keep him out of the hospital.
Exactly. And breast cancer risk. Deep learning models are showing, real improvements compared to the standard risk calculators we've used for years, potentially much more precise.
More personalized risk, perhaps?
Sort of, yeah. And another big one is atrial fibrillation, or AFib. Deep neural networks can actually predict who might develop new onset AFib just by analyzing a standard ECG.
Even if the ECG looks normal at the time.
Potentially, yes, which is huge because AFib increases stroke risk. So identifying people before they develop it allows for preventative strategies.
This sounds like a truly global effort. The analysis looked at where the research is coming from, didn't it?
It did. The big players are China, the US, and India. They're publishing the most.
Any standout?
Well, the US seems to be a real hub. Lots of research output, but also lots of international collaboration. Strong partnership, especially with India, actually.
So knowledge is definitely being shared across borders.
Yeah, it looks like a very connected research community driving this forward.
Okay, so we see the potential, the growth, the applications. What does this all really mean moving forward? What are the big hurdles or next steps?
Well, the potential is enormous, right, for better healthcare, maybe even more equitable healthcare if these tools become widely accessible.
But there must be challenges.
Oh, definitely. The absolute key next step is rigorous testing. These AI models need to be validated properly in actual clinical settings, not just in the lab. We need proof they work reliably in the real world.
Makes sense. What else?
We also really need to train healthcare professionals, doctors, nurses. They need to understand how to use these tools effectively, how to integrate them into their workflow. It's a big educational piece.
And I imagine ethical questions come up too, like data privacy, algorithmic bias.
Absolutely crucial.
Ah.
Patient privacy, data security, ensuring the algorithms aren't biased against certain groups. The whole black box problem of not always knowing how the AI reaches a decision. These are major ethical considerations that need careful attention.
So a lot to work through, but the promise is undeniable. AI really could revolutionize how we manage NCDs, moving us towards more proactive care.
Totally agree. It's a shift. And maybe something for you listening to think about is how these kinds of AI advancements might change your own health journey someday. Moving away from just treating sickness when it happens.
Towards actively preventing it, using these early insights.
Exactly. More prevention, earlier intervention. That's the real hope here.